Okay, Health and Human Service will come to order.
Commissioner Baker McCormick.
Here.
Commissioner Marecki has requested an excuse. Commissioner Anderson has requested an excuse. Commissioner Killeen.
Here.
Chair Scott,
Present.
you have a quorum present.
Thank you. Next item, please.
B, Chairwoman's remarks.
I have none today.
C, approve the March 25th, 2025 meeting minutes.
So move.
We have a motion by Commissioner Baker McCormick and a support by Commissioner Killeen.
Yeah, we're on this thing. All in favor?
The touchpad. Yep. There it is. There's a mouse. You just got.
Okay.
You still here. You still.
Oh, yeah. Thank you.
Motion carried.
Thank you. Next item, please.
D, unfinished business. There is none listed.
Okay, next item, please.
Moving to item 1 under new business, requesting commission approval of Amendment 5 to a 5-year professional services contract with Southeastern Michigan Health Association to reallocate funding among certain health programs.
Thank you. All right. We have someone. Want to give your name, please?
Hi, everyone. Dr. Avni Sheth, Chief Medical Officer and Clinical Care Services Division Director. This is a request for approval to an amendment to our agreement with SEMHA, Southeastern Michigan Health Association. We contract with them to support staffing, human resources services for various different programs across the Department of HHVS and our JYS department. And we do need to just move around some funding within that budget to support some operational needs and staffing needs in certain other programs. The total value of the contract won't change. It'll remain the same because we're using some savings from other programs to cover those changes that are needed. And the term is not changed.
Okay. Any questions? Commissioner Killeen?
Thank you, Madam Chair. And good afternoon. Looking at all the take here, give there kind of stuff. So can you go into a little bit more on, because there's a whole bunch of stuff here, a whole bunch of programs. And so can you go a little bit more into the rationale for why some were cut and some had to be added to?
Sure. So there are only 2 programs that are included in this change, in this amendment. And they are 2 programs that existing programs under this SEMHA contract. One was a grant from the state that we been getting kind of year to year. So it's not one of our continuous grants. And so the state at that time, when we prepared this amendment, was continuing to provide funding in this program. It initially supported staff augmentation during the COVID pandemic for that response, and has extended scope to allow for broader support for infectious disease work. And so because we were renewed at that time for another grant year, we needed to make sure that we could continue that program under the SEMHA contract. So that is unique to that program. And then the other area that needed just a slight adjustment is in the programs under the JYS services, just to support the staffing model, addition of a clinical staff person to that team.
Okay, I'm trying to match what you're saying to what I'm seeing on paper here. So
And so
we saw the changes in our paperwork from previous amendments. So what are the 2, because I see juvenile youth services is picking up 124,000 and the juvenile detention facility clinical is losing 124,000. So how does that decision get made and how is that going to affect the clinical or juvenile detention facility, I guess now.
Right. So, I believe it was to support adding a staff to a certain program that gets funded under that cost center, under the JYS program. I think that there's staff in
JY,
Juvenile and Youth Services
Okay.
program. So I think it's still supporting the overall health services and operations there. But one of the staff, they wanted to add a staff member to a specific cost center that they have with SEMHA to staff. So I believe it's adding an additional staff member to that team.
so that was a request from Juvenile.
Yes.
And then the COVID tracing,
Mhm.
again, that gets $1.4 million more, and $1.4 million less to the FQHC and Hamtramck. So the Hamtramck FQHC board had to sign off on this?
So that one is a special circumstance. So the FQHC is directly contracting with SEMHA now. So we are not in a joint contract with the county SEMHA contract. So they have taken that contract directly. And so are directly contracting services with SEMHA for their staffing needs and going through the proper, channels to
So
do
they're not
that.
Losing any funding.
They're not losing any funding.
It's just something because of that change.
Exactly.
It was just sitting,
Sitting at not being utilized
County.
anymore. Yeah.
okay. And $1.4 million so how much tracing are we doing?
So this is kind of an older name for this grant. It's, our name right now from when it started. So it has broadened scope to include infection control and prevention work more broadly, to support communicable disease control and prevention of outbreaks. And so, yes, contact tracing is part of it, but that's just one piece. So it supports the surveillance that goes along with it, much more broader infectious disease support. We are going through some changes with this one, given the current changes at the federal level with funding this space. And so working through some changes to this, but that is what this grant supports.
Okay, so will that money be able to be used, let's say, for measles outbreak?
Yes, so and we have utilized
Flu
it.
and or?
Yes, so that is the real aim of a program like this, to be able to respond to, all these threats that are kind of looming. We have used it in the staff that supported, that were funded by this grant have worked on our prior measles responses as well. So that is how we've utilized it in the past.
And I guess I would also request, as each minute goes by, funding from Washington becomes more and more uncertain. I would request that, and a lot of it is in your department,
Mhm.
either feds to the state to us or directly from the feds. Can you keep this committee, the commission, apprised when the funding cuts, when and if they come, where they're going to come from Washington, if they're going to stop funding? A lot of stuff in this Health and Human Services area. They've already cut out some of the smaller agencies in Washington. Child abuse, we don't need that anymore. So can you keep us apprised as it happens, when there's funding cuts that are going to affect Wayne County residents who had previously been getting services that may not anymore?
Yeah, we can certainly keep the commission updated with this. We are closely tracking this and trying to, it's hard because it is largely not super predictable and does not come
I know, yeah.
with significant advance notice. This grant specifically is one of those that we have had an impact with, and we're working right now. Happens to be when we are presenting this in front of commission, but we are working right now to make some changes to be able to continue the capacity that we need and have, you know, at least in this area, made some good progress with increasing capacity through other areas that we can, because we do know that, like you mentioned, measles and other threats are just around the corner, and we want to be ready for those.
Madam Chair, if I may, I want,
Sure,
let
go
me,
ahead.
let me state this in a different way then. Do you have, I'm sure you do you have available something you can share with the commission? What is the kind of federal funding we're getting right now in grants in this whole area? So that we can see how much federal money is here in this various forms. Because I'm also trying to keep track of how much, particularly Medicare, supports services. And if there's cuts there, I mean, Medicare is something like 80% of the Detroit Wayne Integrated Health Network budget. And the services that we provide, and of course, we do it through our FQHCs and, well, not ours, but the FQHCs in the county. So do you have a listing right now that you can share? These are all the federal grants that we're getting or federal spending in the area of health and human services.
Yeah, so we've done some work for, you know, in preparation, looking at this different
Sure you
angles.
have.
And so we do, you know, we are
Probably more
keeping-
nervous than me because you see it every day.
Right, yeah. And so we can certainly provide more information on, you know, the potential federal grants that we're receiving and, you know, ones that we, you know, are keeping a very close eye on.
Yeah, I think that will be helpful. The more the commission knows ahead of time, you know, the worst thing is to come in at the last minute and go, uh-oh. And then I would be scrambling for, okay, how does this? So if we kind of know ahead of time where all the federal money is. And I'm not going to ask you for a risk assessment because it's all at risk. And they're messing around with a budget statement in DC now. And I've just seen references to cutbacks in Medicare and Medicaid in the media without any specifics. So as they move into their budget over the next 3 months, whatever it's going to take them, that's going to be when it really hits the road for us. And I guess the last thing I would ask, Madam Chair, you know, when you look at the list of all the programs that we got in our paperwork, that the SEMHA grant supports, quite a long bullet list. How many people are working here from SEMHA under that grant? And I don't know if you have it today, but if you
Yeah.
could submit a list.
Mhm.
And also, you know, it's always been discussed, we want to get folks in here and turn them into a full-time county employee. So if you could share a list of to the committee of how many people we have from SEMHA working under these grants and how many of those folks we've been able to make into full-time Wayne County employees. Is that possible?
Yeah, we can certainly provide you know, the total numbers of how much current staffing we have through SEMHA and work with some of our teams to, you know, identify county positions. I think that there's been, you know, the SEMHA grant specifically is utilized to do a lot of the work that I spoke about earlier is, you know, rapid deployment of staff and augmentation and expanding our capacity beyond what our core teams can function at to be able to be nimble and be able to respond appropriately and meet the needs. And so there is that aim of having something like a SEMHA contract where they are very familiar, have a long history of working with local health departments, have a long history of understanding our state requirements and what we need in terms of meeting operational needs. And so there is that role that we will always need to have to be able to be prepared as a health department. And then parallel to that, we are actively recruiting into our positions, working with our budgets to try to expand programs as much as possible, and have, I think, made a lot of progress in that area.
Well, yeah, fine with all that you just said, right? And, you know, in my year or two that I've been on the commission, these contracts to hire people like from Semha or other places, right, where we don't have county employees, we've hired people to come in. I've never been crazy about that. You know, I think that county employees, I know we have some difficulties with that hiring and sometimes specific skills or something. But I would just like to track how many Semha people do we have here? Because I'm familiar with all the issues you're saying, but I'm also very curious as to how many of these folks we've been able to turn in to full-time county employees to, you know, so that they're under our budget and they're public in that way. Because every year I vote on a budget that has about 4,000 paid for jobs in it for Wayne County. We're sitting on 2,700 employees. So to me, it's like, well, there's money in the budget for 1,300 other employees. And so when it comes to like hiring folks, there's a pot of money there. We can deal with why or we can't or whatever in individual circumstances. But I see that big chunk of money there going, we should be able to turn more people into county employees that come to us like under a Semha contract. So if I can get that, how many Semha employees we have, you don't have to go through each department or each specific job. This is how many we have, and this is the number of former Semha I won't call them hirees, but former Semha employed people that are now county employed people.
Yeah, I think the caveat there is that that's not, you know, there's not always an apples to apples, you know,
I understand
transition
that.
to the county. And so there's various different reasons why a certain staff member may be a Semha employee,
As
as
I
you are
said,
well aware of
we'll
it.
cross those bridges as we come to them, but I want to see just kind of the general flow here, right? Are people coming into county employment as a result of it? Because that's one way that it's always sold to the commission, right? Oh, yeah, we're going to do this. We're going to bring these people in, but we want to turn them into county employees. Well, I want to see how much of that is actually happening. We can have those other discussions at another time, but I just want to see how much of this is actually happening, that the employees we get, and it's other labor, it's other contracts we have too. But in this circumstance, so my request is pretty straightforward. How many Semha people do we have, and how many have we been able to make county employees as a result?
Okay, we'll see what we can get. We'll regroup internally to see what data we can provide
Yeah.
regarding that. Again, it's, you know, I understand how it may have been framed, but I would say that that's not always the goal of converting them because there isn't necessarily a county, classification or, structure to kind of easily convert. Like the nurses, for example, we have been trying to always recruit into our county positions and say, hey, these are the, programs that are available that we would love for everyone to join. But there are other nuances to why they didn't, because oftentimes they are working, this is their, they're doing a part-time, second shift type of situation, and they're not ready to go into a full-time.
Right,
So
and I'm
it may
aware of
not
those.
provide, yeah.
I'm aware of
Mhm.
those, and that's why I gave
Yeah.
you the caveat I did.
Yeah.
But in this chair, I have an oversight role.
Mm.
And so I want to see some basic numbers, that we went into this and we were told, just how is it working out in basic numbers? And then we can get into more
Yeah.
specifics if we need to.
Yeah.
But just numbers right now, two numbers. Thank you. Thank you, Madam
You're
Chair.
nodding your head. Would you be able to do that?
Yes, we'll
Thank-
try to regroup and provide some update regarding that.
Thank you. And thank you, Commissioner.
Thank you, Madam
Commissioner,
Chair.
Commissioner McCormick.
Thank you, Madam Chair. DHHS, housing of the juvenile, youth. I'm not sure if I talk about this in this area, but, do you know the status, or maybe should I ask Fernandez, the director, about that? Because I know we had challenges, and I'm just looking at the movement of funds. Is that going to have a impact, and does that have anything to do with program development? Okay.
Good afternoon, Melissa Fernandez, Director of Juvenile and Youth Services.
Thank
So
you.
your question was about residential beds?
Yes.
Okay.
DHS, HHS, and I know we've always had problems with them. I just want to know the status of that. And does that have anything to do with program development, and making sure that the juvenile get the services that they need to get in and out?
Sure.
Okay.
So we're continuing to work with DHS and our court. We meet weekly. Currently, we have 30 young people at JDF waiting for level 2 placement. We've also been meeting with our current providers, such as Spectrum and some of our other providers in the state regarding vacancies. We are placing young people in those beds. We still have issues with vacant beds all over the state. Part of the issue is the length of stay in some of these long-term facilities, right? And so we are really looking at best practice and the length of stay in these facilities regarding how long young people get there so that other people can go in. So yes, we still have an issue with placing young people. We are really working on trying to get them placed, and we're actually looking at releasing an RFP so that we can start our own 30-bed residential facility inside the JDF. So remember, JDF has 160 beds. We are licensed for 130, and we are very happy to say we have been consistently under 100 for some time now. So in analyzing the situation and looking at how we can provide our own relief, that's one of the things that we're looking at, is standing up our own residential
Okay.
program so that we can address these issues.
All right. So is that program development? Is that what that means? What does program development mean here?
I'm not sure what are you?
I'm looking at, it says 124,000 is being moved to program development juvenile.
So that's specifically in our
is-
medical and clinical department.
okay, so not.
Correct.
Okay, this is just the clinical part.
Correct.
Okay, well, going back to what you just said about developing a program that would help with the shortage of beds, would we be able to develop that program and still provide quality services for the current juveniles that we have
In the
in
facility?
the facility?
Correct. So those would be two separate
Yeah.
licensings. One licenses, one would be a child caring institution long-term and one would be short-term. So they would have very different standards, but yes, we would be able to.
Okay. And then I had a question about the dental services, and what that looks like. We're looking at, it says, we've contracted out for dental services.
Yes.
So when youth are there, is it general dental services, or say, for instance, they need braces because they're there for unfortunately sometime over a year? If they need more extreme services, can we provide those, and what does that look like?
So we do have a dentist on site. Dr. Pam Bradford is our dentist, and she does provide the general services and services as it relates to child caring rules and what needs to happen as far as exams. She can conduct basic services, but we don't provide anything such as that. That has to be referred out. I do want to comment on the length of stay. We have seen a significant length of stay. Today, we have only one person that's been there over a year,
Okay.
and that's because they have an adult case. But we have been working closely with the courts in really deep diving and defining what it means to have a young person in detention, especially with our juvenile justice reform rules as it relates to our detention screening instrument. We're doing a better job of screening who really needs to be in detention and who doesn't.
Okay. So only one? Oh, that's great.
That is correct.
Oh, that's fabulous, because I know at one point it was quite a few
Yes.
that we
yes.
had. So,
Majority of our young
Right.
people have been there on the high end, about 130 days, on the low end,
okay.
30.
Thank you.
You're
Madam
welcome.
Chair. Thank you.
Thank you. Thank you so much. No more questions, and we have a motion.
Yeah, I'll move it for approval, Madam Chair.
Okay, moved by Commissioner
Well,
Khalil,
now support.
supported by Commissioner McCormick, and I vote yes. No,
No, just click on it.
okay. All right, thank you.
Commissioner Khalil?
Permit Sue.
Just.
Oh, oh.
yeah.
I go, yeah, that's me.
Motion carried.
Thank you. Next item, please.
Item 2, revision 2 of resolution number 2024-027, an intergovernmental agreement with a 3-year option to renew with Wayne State University Center for Behavioral Health and Justice.
Okay. All right,
And I had a question.
Commissioner McCormick.
All right. So one of the things that I asked for, we just approved a contract for access at our last meeting,
Mhm.
which the funds came from the opioid settlement. And as we start spending down the dollars, I'm just, I guess, curious, and I asked the question at our full board, and for some reason, there was some controversy about asking about how we're spending this, and are we looking at analyzing who needs it most and what areas and how these funds are disseminated, and if we're rolling it out in a, I guess, fair and compassionate way. And for me, I'm hearing, and I don't know the numbers, and that's one of the reasons why I've asked, who is hardest hit in Wayne County? What areas of concern do we have of the number of deaths, so that we can focus on those areas first? Not saying that any other area doesn't have issues or problems or need. I just know that I'm hearing that in Metro Detroit, African-American males are really being hardest hit, and it's almost like at a epidemic. But again, I don't know, because there hasn't been any analysis provided as to the numbers. So I'm really concerned about how we're going to roll out these funds, and if we're looking at it in a strategic manner. And so I don't know if you have any numbers, if you can provide numbers so we can see how we can best spend down these funds.
I appreciate your comment, Commissioner McCormick, and I just want to reassure you that we are definitely leading with that lens of understanding the data, what is the extent of the problem in Wayne County, and what are disproportionately impacted communities. And so right now, we are in the midst of a comprehensive needs assessment of substance use and overdose impact in Wayne County, where we'll be looking at not only our deaths in Wayne County, but drilling down to who is most impacted, right? Which communities are disproportionately impacted? And you are absolutely right. In Wayne County, the African-American community is disproportionately impacted by overdose deaths and the resultant harm from that. And so we're trying to drill down at our geography and our municipalities and identify municipalities at higher risk, that have a higher burden. And yes, we want to make sure that these interventions reach broadly, but then that we are having a more intense focus on those communities most impacted. And so I want to make sure that we provide you information in a more comprehensive way. And so we can follow up with kind of a snapshot of what we're seeing with the data and some communities that are more impacted and that know that there is a comprehensive reporting that is underway that we are working on that will be shared as well with the commission once it's completed. For this initiative that's before you right now, I know this is just a technical change with the budget lines on the PO, but I just want to lift up this project as an example that really illustrates what you are, what you spoke about. You know, we know that naloxone, Narcan, this life-saving medication should be everywhere, right? Should be in the hands of everywhere. Every municipality has had an overdose death, right? And so our strategy here is to make this accessible everywhere, but then also focus in and target communities that are disproportionately impacted. And so more intense focus on those communities, placing these sites, these vending machines, these distribution boxes in places where the communities and the people that need it the most have access to it. We are also layering on a communications campaign with that in mind, with our priority communities in mind, and really targeting those communities in that rollout.
Great. And that's what I was going to ask. How are we communicating this to the community so that, you know, people know that they can actually go pick up, you know, a pack to just have ready, have one in their vehicle or at home. I think it's real important. And as we look at the demographic numbers, I would be really interested in knowing what type of opioid. Is it the kind you put in, I don't know if they put it in a joint or you wrap it, or is it a pipe, or is it a pill? What do we have any statistics on how these things are being ingested? I'm not really sure. I have no idea how, you know, I know it comes in different forms and pills, but I think it's important to know how it's being ingested. And I think more importantly, we think that, oh, this is, you know, a drug addict on the street that, you know, is addicted, rather than the business person that gets a hold of a bad medicine or pill that they take and they die from it. What demographic of people, you know, what income level, that data I think is real important, because I know the community and the people that I'm around, they don't think of this as somebody that I would know that could die from it. And it's happening around us, but nobody's really saying anything. It's like a secret. You know, nobody wants them to know that their family member passed away because of this. And if we don't let people know that people like us are dying from this, then we're going to continue to see these deaths, and it's going to be a quiet epidemic. So that's all I have to say about it. I'm just-
If I can just add, and thank you so much for sharing that. And, you know, all of the points that you lifted up are definitely top of mind as we roll out our strategy around this. We are really trying to lift a lot of the stigma associated with this. We know that substance use overdoses, substance use harms affects everyone. If it hasn't affected anybody personally, they are just likely 1 degree removed from it. And we are really trying to lift the stigma and everything. And so I want to also lift up our communications campaign and where we are kind of housing everything centrally around endoverdosewayne.org. A lot of the things you mentioned, we are trying to build out on this landing page in terms of resources, educational materials, really simple, short videos for people to watch, to really get educated and informed. We're going to be kind of housing a lot of the locations for these, how to mapped all the sites where the existing machines are located. There's a lot of really great information out there on it now that we are going to build on that really highlight a lot of the information you spoke about. And so endoverdosewayne.org, we have some materials that we'll share broadly with the commission to share to your communities and your constituents and your loved ones. We really want to get this messaging out. And really, you know, we are trying to Commissioner McCormick's point is to, shouldn't be secret, right? We should be talking about it, normalizing this, and just making sure everyone's informed and educated.
And I think we were supposed to receive a 1-pager or a flyer of some kind.
Yes.
At some point. I don't know if you have that we can put in our newsletter or just social media.
Yeah.
Share it. That would be great just to start. And I don't know what that communication looks like, but if you could have something where, you know, the demographics, these are people, everyday people that are dying from this. I don't know. Thank you.
Thank you for that.
Mhm.
Mhm. Yeah, well, how is the ratio? Is it worse now or is it getting better?
In terms of our fatality rate, yeah, so we're
Yes.
looking at the most recent, we're right in the middle of analyzing our most recent data in Wayne County, and understanding, you know, it's the variation is different, depends on where you look. We know that at the state level and national level, we are grateful to see a decline in overdose death rates. I'm sure many of you have seen that in the media. We do know in Wayne County, we have unique underlying problems and root causes that drive this. We don't anticipate as significant of a decline as we see at the state or national level here in Wayne County. And we are looking at kind of understanding what communities are most impacted by that. But we are, you know, we're trying to look at City of Detroit, look at Wayne County because of our jurisdictional borders too, and understand that data. But we likely do not have as much of a decline as seen at the state level, 1. And 2, we know that our communities that are most impacted are still disproportionately impacted. So our African-American community, and interestingly with our local data that speaks to Commissioner McCormick's point, is an older population, so 55, 65 and older, have seen increases in overdose fatalities. And so we'll be kind of producing a more comprehensive report around that. It's, you know, we're right in the middle of it, near the home stretch of it. And so really looking forward to sharing that with you all.
Okay, thank you. Commissioner Colleen.
Thank you, Madam Chair.
Mhm.
And when you share documents, could you do it in JPEG format
Yes,
or?
or the PN, yeah. Mhm.
Yeah,
We'll share it in a shareable format.
Yeah, that would be nice. So the original amount of money that the commission approved for these Narcan rollout across the county, do you remember what that original amount was? I want to say it was like 5 million. We approved, I mean, because right now we're just changing the account numbers
Mhm, mhm.
on what we already approved. So we have spent, the county has spent money.
for what's out there for Narcan. And then we wanted to contract with Wayne State University. And I found out after our last meeting that the website to go to is not End Overdose. That's End Overdose Wayne.
Yeah.
Yeah.
Mm.
I'm like, what the heck? What the heck? Are all, two things, are all of the locations on End Overdose Wayne?
All of our locations are on endoverdosewayne.org. We are updating, we are actively rolling out new
Yeah.
locations. So we're trying to do with our partner regular updates. I don't know if they're weekly or bi-weekly.
Wayne State being our partner.
Oh, so for our communications campaign, we're working with another vendor, Brogan, on that.
Not for the siting, but for the website.
Website, exactly.
Okay.
And so, there are, a couple of sites right now that we're rolling out that may not be on the, on the map that we have there, but we are continuously updating it. So that's the
Okay.
go-to place for finding the most recent.
And what's the interaction between the county and Wayne State University on locations? Is there a conversation that happens?
Oh,
or
so we
does
we
Wayne
work
State-
very closely with so we have our kind of county implementation team that works, hand in hand weekly
Yeah.
with the CBHJ implementation team. And so we, the site locations are not approved. We approve the sites, right?
Okay.
But
that's
we
what I
are
wanted to
working,
know.
we are leveraging their expertise and our expertise. And it's really a joint effort in engaging with partners, a diverse set of partners to find ideal locations for this placement. And so CBHJ is our implementation partner in this, I would say, and we are very much hip to hip with implementation alongside them.
Okay, acronym again.
Oh, Center for Behavioral Health and Justice.
Okay, because we're doing our own kind of survey out there. What's the term for it, to figure, where's the highest areas in the county where we have the drug use that
Mhm.
we might want to target.
Yeah.
So we're doing our own. what's
Needs
the-
a needs assessment.
Yeah, needs
Yes.
assessment.
Yes.
Wayne State, I'm sure, has done needs assessments. No?
They're gathering data to guide implementation. Yes.
Yeah,
Mhm.
okay. But we don't have an overall needs assessment yet.
Not a
We can
comprehensive
look
one.
at a map
We
and
have.
go, holy cow, we better have 6 machines there.
Yes, yes. So we have our data around overdose deaths in Wayne County.
Yeah.
Zip code, the municipality zip codes that are most impacted. We do have that is guiding this implementation right now. And, looking at municipal profiles and understanding, the
Demographics.
various different things. So the state has an index called Substance Use Vulnerability Index that provides at the zip code level, uses a couple of different data points that we know lead to worse substance use outcomes, including the fatality rate in that area, and identifies areas that are more vulnerable to substance use and its harms. And so we're using that. That's just one example. So there's various different
Doesn't
things we look at.
Detroit Wayne Integrated Health Network also have data on this?
I believe their data is more focused on, treatment utilization and some of the data that they have through their provider network.
But that can also
Mhm,
lead
that
to
helps,
where,
supports.
right, because now that for the last, 10 years, substance use disorder has been put together with the mental health
Right.
authority in this case. They have a lot of knowledge. And in fact, when we talked about this before, many years ago, DeWin, when I was on the board, did identify Southwest Detroit and Dearborn as a real hotspot, because then we have the folks that both have substance use and mental health issues. There's a correlation there. So their data was showing that southwest side in Dearborn was one of the kind of hotspots for that. So, okay, so Wayne State in conjunction with us, and we have to sign off on where the locations are.
Correct, and we work together.
Okay.
On identifying sites and locations.
All right, I'll
and,
look it up on the website then and see what we have, knowing that the website might be trailing a little bit what's actually happening out there.
It's pretty up to date,
Yeah,
so,
well,
and, we're rolling, right, with this, and so we are continuously open, updating and refreshing. We do, gather input if anybody has recommendations on sites and locations, please let us know.
Yeah, but I can't do that without having data. Sure, every commissioner would like, I want 12 in my district, right? But there's got to be data because money is
How many? do
limited.
we- I'm sorry.
I haven't seen, yeah, I don't,
Yeah, so we have,
A bunch.
I have it in front of me. We have about 52 machines placed. Machines are the kind of newsstand-like devices. So we have coverage around 24 out of 43 municipalities. So about half of municipalities have access within the municipality border. And we have obviously 52 total sites at the moment and rolling out additional ones in the coming weeks. And, we are really focused on trying to make sure that we have access in the hardest hit communities, and working, on making sure that we identify sites that are.
Can we get that information?
that's-
Okay.
and if lost my train of thought on it. Oh, nonprofits, can they be sites?
Yes, so we have a very
It's not just
diverse. Mhm,
Schools and,
exactly. Mhm.
and governmental units, but we can.
Correct.
Okay, so I can be on the lookout for that, because I do have a sense of who is dealing
Mhm.
with this population. That would
Right.
be and can it be done in the city of Detroit?
So we do have some sites in the city of Detroit. We're working collaboratively with Detroit on ensuring that we are using all of our resources well, because they are also working on rolling out access in the city of Detroit as well.
Yeah,
So we
'cause I
do
think
have,
There's a overdosedetroit.org website.
I'm not familiar with that one. I
Okay,
know that
there's
they
not,
have some
but-
information.
But the short story is,
We do
yes,
have,
we can.
and we do. And so we have
And so
specifically
sites
at
in
our.
Detroit are suggested to you, then you'll talk with the Detroit Health
Ex-
Department
And coordinate and
and
see
say,
if
what do
it's
you have
a,
over there? What do you think? That sort of, okay,
right.
just so I know on suggestions.
Yeah, because at the end of the, it doesn't matter who's doing it. We want to make sure that there's
Correct.
access, right? And so that is what our goal is. We do have several sites in this, in the city of Detroit
Yeah,
right
yeah.
now that you will find on the map as well.
Okay. Thank you very much. Thank
Mhm.
you, Madam Chair.
Okay. Thank you. Mr. McCormick, you okay?
I
Okay,
am.
all right.
Thank you.
Thank you so much, Doctor. Motion, please.
We have a motion by Commissioner Baker McCormick and a support by Commissioner Colleen.
Thank you, and I vote yes.
Motion carried.
Okay. Thank you. Next item.
F, such other matters as may be properly submitted before the committee.
I don't know of any.
G, public comments.
Okay, is there anyone online?
There is no one on Zoom indicating that they would like to speak, and no emails were received.
Okay, thank you. Is there anyone in the public would like to make a comment? Would you want to come up to the podium, please? Your name, please?
Maya Scott,
Maya Scott.
yes. Good afternoon, everyone.
Okay, you can speak for a minute or two.
Okay,
Okay.
awesome. Good afternoon. So
afternoon.
a previous employee with the Wayne County Juvenile Detention Center marks from November to recent of February. Thank you for having me. here. It was very interesting discussion, and a few things I guess I want to pinpoint, that was very interesting to me.
Yeah. Maybe she should just come down. Mhm. Okay.
All right. All right. Um, First, I would like to say, just because recent, we just left off the conversation of the narcotics and things like that. And it breaks my heart because as we're speaking upon these things, this is things that's currently going on that I've seen with my own eyes in a detention center where I've seen residents actually passing drugs to one another with no concern or no supervisors. Or I would say any managers have approached in a proper way, and they are of note of this. So right under our eyes, are we allowing these things to happen? Right. My position. Well, another thing that I would like to acknowledge is Mr. McLean when he was asking about the retention and how are we able to turn, employees, right, into Wayne County, long-term, how would I say it, employees, I would say, under your budget, but I don't think that there would ever be an opportunity for that because of the standards of which the juvenile hold and their leadership, right? I was bullied out of my position and I tried to hold on as long as I could with no support of leaders. As a part-time employee, actually trying to go to school to continue my education philosophy, had no support, right? We're already, right, as a part-time employee, I was on 7 days, trying to give my all, right, of what I could do, in the time that I was there until I got picked my classes back up. But seemingly the support is no interest, right? They don't want you to be a long-term employee, right? They want you to submit under what they have going, and if you do not submit to what they have going on, then they want you gone, no matter the experience, right? One of my concerns in December, winter break, a few of the residents, right, were taking off of medical 101s. 101 is basically when you have a employee stick by a resident that may be going through suicide ideations or just really can't be left alone, right? You had one of your managers by the name of Mr. Johnson come in and say, everybody's off 101, right? In the midst of him coming in to pull these children off of their 101 staff, I was currently dealing with a crisis, and I'm not even certified to be a crisis technician. There was no crisis team that reacted to the call. There was no manager or supervisor that came in to handle the call. I was on a 16-hour shift, and I stayed until I was able to stop that young lady from have a desk and they have their bed and they're very thick. So she was banging her head against the desk, and it was just, I was in there soothing her. And what was so disturbing is that her case manager, right, stood there. When I say just stood there and talked to that resident as if it was a dog, telling her, you need to get yourself together. You need to do X, Y, and Z. In the midst of me trying to reach out to crisis, I just reacted on my own because there's no way that I'm seeing this resident get treated like an animal in the midst of them trying to take them off of 101. I stepped to every manager on the floor, and it was only one manager that told me to go immediately do an unusual report, right? And if it wasn't for him, I wouldn't have known what to do. And in addition to that, right,
It's a liability to have a former employee continue to speak.
in addition to that, I reported because I overheard a resident, I guess one of the residents had got, he's on a one-on-one on and off simply because of him chasing the opioids or the dosage of medicine that they give them, right? He's conversating to a group of, oh, I know, I have to stop, but
Yeah. I'm not allowed to allow you to
I'm
speak any
sorry.
longer, but thank
Okay,
you.
no problem, but just
coming and
saying
share.
all that to say is that it's help that's needed. And I understand you guys are budgeting funds and this, that, and the third, but you really are pushing away passionate people. I don't just, work or, came in for a job. I came in because I do this work in the community.
Thank
And
you.
it really hurts. So that's,
Right. Thank
I
you, Ms.
yield.
Scott. Yeah.
You're welcome.
Okay, next item, please.
Adjournment.
It's been
Support.
moved and supported, and I am favorite also.